And HPV is human papillomavirus. It is a very common virus that most people at some point in their life will have. Having HPV does not mean that you have cancer, and that's a really important thing for people to know. It's the persistence of the virus over a period of 10 or 15 years. If that persists, that's when the cell changes can become cancerous. So our goal is to pick up things way before they become cancer and treat them. I'm Dr. Maggie Carpenter. I am the Executive Director at GoDocGO. Our team comes from New York, Philadelphia, Martha's Vineyard, Seattle, and we came to bring extra treatment for cervical cancer prevention. So we've brought a HPV testing unit. We've also brought a LEEP machine, which allows the doctors here to be able to treat cases before they become cancer, so that it prevents cancer, and a thermoablation unit, which they already had, but now they have another one that can go out into mobile clinics and out into more distant, remote areas. We started our week here with doing an educational session with the hospital doctors, nurses, and midwives, talking about the basis of cervical cancer screening, why it is so important, and then showed how to use both a thermoablation unit, which is a very small unit with a portable battery that allows you to treat the smaller lesions with heat, so it heats up. It's only the treatment only takes a minute, and then women need to come back a year later. And then the other machine that we brought is called a LEEP machine, and that is a machine that uses electricity that goes through a wire and allows you to surgically remove areas of the cervix if they are affected. It's a really amazing tool because you can not only treat, but you also then have a specimen to be able to send to pathology, so you can get an accurate diagnosis. Cervical cancer is a completely preventable disease. The World Health Organization set a target of eliminating cervical cancer by 2030. That doesn't mean that there won't be any cases, but the goal is to have a large majority of people screened at least once in their lifetime for HPV, and have a visual inspection with acetic acid, as well as treatment being available, because there's no point in screening if you can't treat people. It's all set up, and I feel very confident in their skills to be able to screen and treat patients with both small and large lesions. We brought 500 HPV tests. HPV testing is superior to visual inspection with acetic acid because it does not have the limitations of objectivity. So you're not relying on somebody to look and see something. It's a test that can be done in the lab. And what's really beautiful about HPV testing is that women can self-collect their sample. So for a lot of women, having a speculum exam is uncomfortable, nerve-wracking, anxiety-producing, and so being able to just use a swab to be able to test for HPV is really a bonus, and especially in areas where people aren't as used to having gynecologic exams. So to be able to offer them something much simpler is really a great option. It's always really fun when we go and do screenings in hospitals when we know we've gotten people's confidence, when the staff start showing up to get screened as well. And so this morning it was really fun to see staff from around the hospital come to get their HPV tests and get their visual inspection with acetic acid.